Hey guys, I'm back with another video. So this time I'm gonna talk about more of the nursing resources I use for NCLEX. I've noticed on my comments from the last video, generally people being nervous and congratulating me. Thank you everyone. And I've noticed some comments about like also being a retaker or just getting the results. And so this is so I'm going to dive more into about what I did and talk more about the resources that I used. And I guess I also want to touch upon like the focus of what you should do. And this is different for everyone as well. Like it depends what kind of person you are. Like personally and like many others, I'm just a bad test taker, and especially when you get anxiety and you're not thinking and all you're just like you're just panicking. So that's what I'm also going to talk about. And a lot of stuff I have mentioned in my last video, so this may be me repeating myself. Um, but but the fact that I'm repeating it also shows that I personally think this is very important, especially as a second time retaker. So we're gonna get right into it, and I'm sorry for my mic quality and the video quality. I'm recording from my laptop this time. I'm usually on my phone, but I'm hoping to get a new laptop within the year, hopefully. We'll see about that, and I can have like better quality things. I'm also trying to get a new mic, so my voice ain't like kind of dank. All right. All right. So I'm gonna start with how I studied. So I mentioned this in the last video, like that I took the NCLEX twice and I passed the second time. The first time I didn't study that well. I took 3 months, guys, and my routine was whacked. It was so janked. It was all over the place. I was juggling between my family life and my studying. I had no routine. I was just going with the flow, especially being like fresh out of nursing school. I just wanted a break, and it's again, it's different for everyone. There's nothing wrong with taking a break. It's on you. I wanted to spend time with my family, my friends that I hadn't like seen in a while because I was always so busy during nursing school, and and I was also dealing with my personal problems. Um, so it was a wild 3 months, but I did the best I could when I was studying the first time. And I mentioned the first time I only used UWorld and Hearst. So I use Hearst for content review. Their lectures was very informative. So they give you a rundown of every system. They talk about like the common disease that are typically tested over NCLEX. These are things that you should generally know. Like for example, diabetes. Like you're going to get tested on diabetes at some point, and medications related to diabetes. You could get some basic kidney questions. You could get some questions about the musculoskeletal system, questions about cardiac. It's all over the place. So this is something to also stress. Like you could get anything on NCLEX. There is no like it's not fixed. Like oh, you're gonna get like 2 questions on this. You're gonna get 5 questions on this. It's nothing like that, and people are always asking, hey, how many questions did you get over so and so? It's different for everyone. It genuinely is. The most common questions I typically see is like, hey, how many questions did you get over farm? Like, some people get none, and some people get like 1. Some people get like 5. I've heard someone get like 20 farm questions, and it might not be just like a medication question like what is this drug, what does this drug do, or what do you expect to see from on this drug, etc., etc., etc. Like you it's like I said, this you could get anything, and there's no fixed amount of questions on a certain content. It's just RNG, random. It's all random. You can get anything, and it is the way it is. Don't come in with a mindset of, oh, I probably won't get it, or oh, it's just one question. It's fine. Don't go in with that mindset. Just expect to get everything. Um, that way, I think it'll give you less anxiety, because if you know it, you'll know it. And if you don't, then you're gonna start panicking, and that's when testing anxiety will kick in, and you're just gonna be like, oh, what do I do? What do I do? What do I do? I don't know what to do. I don't know this question. Let's just guess, and then you move on, and then you're like, wait, I shouldn't. Wait, it could have been the other answer, and you gotta remember you're on a time limit, and you already answered a question. You can't go back. You gotta move on. Just gotta go. You can't dwell on that past question that you already answered, unfortunately. And that might sound mean, but I mean it. You just have to move on. But yeah, I'm sorry, I kind of like idled off on the topic. But yeah, the first time I studied, I was a mess. I tried to stick with a schedule. It was a very lax schedule, I would say. I don't think I was. I just wasn't hard enough on myself. I get it is what it is, and not only that, I was using U World, and U World gives you a very large test bank on every content. It's like a little over 1,000 questions that they give you. So it's a lot of content, and I'm doing all these I'm doing all these practice tests to get myself into the NCLEX like testing setting environment, basically. And I'm only thinking about the content of the questions. I'm not really looking how they're asking you, and that is something I will touch on later. But doing these questions also help, like reading the rationales. You should definitely read the rationales, but even if you get the answer right, it's good to read the rationale as like kind of a refresher course, and you'll be like, yeah, that's what I thought. And it's also like give you a little confident boost. It's like, yeah, that's exactly why I got this answer right, because this is the rationale they were looking for. And if you get the answer wrong, it's no big deal. Like, read why you got it wrong and understand why you got it wrong. And understanding why you get a question wrong is just as important as knowing the content itself. Like, you got to understand why you got the question wrong. Like, did you misread the question? Are you not understand what are they asking you? Are you just looking at the wrong keywords? Things like that. And that isn't what I focused on when I was studying the first time. When I was doing New World, I was just, I was answering questions. Whatever I got right, I kind of just skipped over them, and then whatever I got wrong, I'm reading the rationale. I'm writing down notes. Like, I'm physically writing down notes, because that's the kind of person I am. I learn better when I'm writing notes instead of like typing them. And I was just going way too damn slow. It is what it is, because like writing takes us twice as much time to do, especially if I'm highlighting everything, I'm trying to organize everything, all that good stuff. And another issue is like sometimes most people find this problem once they write something down, they don't typically look back over it. It's just kind of and so it's like you have to make like an active effort to get your stuff back out, put it in front of you, and read. And it's one thing to like, it's different skimming through it, because you already wrote it and you're like, I wrote this, I know what I put down. But even if you wrote it, you gotta sit down, look at your thing, and read it as if you're reading a textbook. Like, you can't just skim over it. But then again, that's just how I am personally. Like, but But you're skimming over like your notes and stuff and just going with like, oh, I wrote out everything. And it's like, I want to go with that mindset, like, because then when you're in a test and you're like, I know this, and then so what the head, it's like I should have read my notes better. I should have took the time to review it. It's like, it's that kind of thing. No, sorry. Yeah, and yeah, with Hearst videos is I used it for making content and trying to what I did was I watched it first while filling out their worksheets, and then I listened to it again, and then I listened to it again while going through the notes, like trying to actively read them. That's what I did. So that's what I would personally say how Hearst is more about content review as a refresher course for you. Remembering this is what you learned in school, remember what these diseases are, and understanding some treatments. It's very systematic. I like to think they did it very systematically, telling you signs and symptoms especially, and yeah. So that was the first time I studied, and I definitely recommend Hearst if you're interested in using it as a study material. It's a little pricey, but if you think you can buddy with a friend, like if they have videos, you could also do that as well. But I recommend paying for it. Some people will skim over like paying for something just to save money, and I get it. These materials are expensive. UWorld is expensive. I paid I think $200 for continuous subscription with them, and that's just total. Studying is also very expensive, and you got to make the most out of what you can for one test. So the second time I used Hearst again. I did the same thing. I listened to the videos, trying to actively read the notes that I took, and went from there. And the second time I picked up Mark K. So there are no so he has a yellow book and a blue book. I focused more on was it the yellow book? I think it was the yellow book. I didn't really focus on like the blue book that had like the little facts. I might have got it, but either way though, like I'm listening to his lectures and I'm writing down notes, and I'm listening to the lectures like twice or three times, like per video. There's like 12 lectures, and I'm listening them to like 3 times each to make sure I got everything and I'm understanding what he's saying and listening to the advice he's giving to these students. Now these lectures are online. They might be outdated. But I'm not sure by how many years. Some people told me, oh, these lectures are from like 2008, and I've been looking around. I see people posting these lectures from 2021. I was like, I'm not sure how recent this is. But sometimes I'll look on Google and people have shown like new versions of his lecture, updated versions of his lectures, and new stuff he's talked about. And so I would take some time to listen to those and just take my own personal notes over it. And the thing about like you can find his books on like Quizlet and other websites as well, but personally I just pulled up the video. I got like a fresh journal, like it's a journal, not his fill in the blank books, and took my own notes. And because I've mentioned this a billion times already, I learned way better writing it, and I'm going to continue doing that. If you know how you learn, don't try something new at this point in your life. Like, don't try something new at this point when trying to study for NCLEX. If you know you can type up your notes and organize your notes on your laptop or whatever you're using, keep doing that. If you learn better writing it physically on paper, highlighting stuff, it's like, keep doing that as well. Like, keep doing what you've always been doing. This is how you got through nursing school. This is how you've been going through life. If that's how you do it, that's how you do it. If as for like jobs and don't get me started about like accommodating to jobs and stuff. That's like a whole other field on itself. That's something different. But as for studying and learning, you gotta keep doing what you've been doing. Don't try something new for something you have like a short amount of time, or at least the short amount of time you give yourself to study for this test. And especially with the amount of content you have to review over, there's a lot for NCLEX, and NCLEX could, yeet at you with anything. You don't have that time to learn something new and try something new. This is different from picking up a new resource. Studying a new way is something different. Like going from writing to typing and then learning. This is not working out for you. You wasted all that time doing something new, hoping it'd help you. I would say you're gonna do that and spend maybe a day, and if that doesn't, I say 2 days. Like one day to try out this new learning style, and then the next day to doing the new learning style as a review. If it's not working out, just go back to what you've been doing. Otherwise, yeah. Because that time you spent could have just been time used for like using your studying materials that you're using. Yeah, but going back to the second time studying, I went back to Hearst again, really just listening to videos and actively reading the notes and Marquet. So I pretty much did the same thing with Hearst, listening to videos, making my own notes, and listening to the audio. I also did like crash course like reviews from this one other YouTuber. Her name is Amanda, and her like slogan is called like beautiful nursing notes, I think, and I will link the video of hers below in the description. Because sometimes when I'm not listening to Marquet and I'm on a break, I would literally put her on and listen to her like 1 hour comprehensive review for NCLEX. It was actually very helpful for me personally, especially when I was taking NCLEX. Because sometimes it'll pop up in my head. It's like, oh yeah, that's what she said. Huh. All right. And I also picked up a bunch of other like studying materials. So on a lot of people mention Kaplan. I never used Kaplan. I did find like a Kaplan book. I did pick up on it. I like more or less skimmed through it, but I thought it was a lot, and I was like, I just don't have that much time. I'm just gonna use what I already have. But what I did find out is that on the Kaplan nursing like website, you can look it up on Google, like it'll probably pop up somewhere. They do have a free like 50 question. It was either 50 or 75, I forget. But like they have a free practice test, like NCLEX practice test, and so I think you just have to make an account, and it's free. You don't have to pay for anything. You don't have to input anything. It's a one-time use. They do give rationale. They do tell you, like they give you the rationales and why you got the question wrong and everything like that. And I think it was very helpful. The format is like NCLEX itself, like how NCLEX would test you, and their questions are NCLEX style. And it's good practice. Like any practice test you have or you can find, do it, because I cannot stress this enough. Like getting the feel for the questions is very, very important. All right, so and that's what I learned the second time when I'm studying. I was like, I need to do more practice on how to test this. So I took up the Kaplan free practice test. And there is another website called TrueLearn. I'll link it below in the description. But you can make an account with TrueLearn, and they give you a free test bank. I think they had 500 questions, and I went through all of it. I did take my time. I took my time, doing these questions. I just did the standard, 75 questions. Sometimes I did the whole damn thing. You can pause it and come back to it later. I only did 75 just because I don't want to be, you don't want to set it to 200 questions, and you're going to try to do it in one go. don't do that. Just do like the standard 75, especially if you want to be like, oh, I'm gonna pass this NCLEX and 75 questions. 75 is fine. So like I did 75 so that I could do it in one setting, and that's about an hour, I say, per practice test. But if you're trying to save money, sign up for TrueLearn. They try to style it like NCLEX. It might not be like the best, but it's still like free material that you could use if you're really trying to save up on money. And I did do UWorld again, but I mentioned in the last video, I did not renew my subscription for UWorld. I actually got UWorld notes from a friend who already did it. Like, her notes are way more detailed than mine were. Or it's kind of, you know, everyone takes notes differently. Either way, like, I barely even finished like doing my test bank, but I took up hers because since she's better at studying than I am. I'm just gonna say that, and it really helped. And the way I think the way it was like organized was that it was split between adult and pediatrics for each content, and that was actually like super helpful for me. And she also had like other stuff on it, and I was just like, okay, yeah, thank you for these notes. I'm going way too slow with all my writing. I'm not gonna get there in time when my NCLEX comes in. I looked at her notes. I skimmed here and there, but like I focused on the content I was super weak in, and that's something to note. As you're studying and you realize what content you're weak on, try to focus on the content you're weak on first, and then go over the content that you know you got. Like, let's say med-surg, for example. Like, if you got med-surg, you know what comes with med-surg, and you got the critical care things down, put that in the back, and put, like, let's say you're weak in pediatrics and OB, put that at the forefront. You study those first, focus on that. Know, like, what do you not know about them, or what are you missing, or maybe there's stuff like you just didn't get in nursing school, things like that. So understanding what you don't know and what you do know helps in your studying, because you're going to be all over the place and just focusing on things that probably don't matter. Yeah. So those are the resources that I used. And what I want to also say, all the resources that I listed may not be for you. Like, Mark K could be for you, but not Hearst. Or Hearst could be for you, but not Mark K. So if it just didn't vibe with you, there's nothing wrong with that. Just find something else that does. Like Saunders, for example. That's another resource I did use, but I thought Saunders wasn't that great for me. I'm not saying it isn't a good studying material. I'm saying I didn't work well with Saunders. I have the book, and I also have the testing bank that you can get online on your Evolve account. And so and like I said, on my second time, I wanted to practice doing questions and understanding them, and so I try to go to Saunders to practice that. But the thing is, personally, I felt that Saunders' questions were very content specific based, and I decided to just read the book rather than do their questions. And it's a good refresher course, and it's also important to remember that between all these resources, the base information will be the same, but anything extra, or especially when it comes to treatments or like lab values, it's gonna be different from resource to resource to resource, and you're gonna need to find like a common ground between all of them, because Mark K might say something, different from hers, and Saunders' textbook might say something different from Kaplan's textbook, and you're trying to remember all that extra information, and then come testing, turns out it doesn't even matter. So when you're going through all these different studying materials, try to find the common ground between all of them, because people tend to want to focus on the little itty bitty details, and if you're just focused on the itty bitty details and not the common ground that they're trying to teach you, like for example diabetes, like let's just say, what is diabetes type 1? It's autoimmune, and every one of these resources are going to tell you diabetes type 1 is an autoimmune, is an autoimmune disorder compared to diabetes type 2. If you're not remembering that, and you're just remembering the specifics of diabetes type 1, like something about the pancreas and the beta cells, and like if you're just focused on the itty bitty gritty things, and you come testing and it's like diabetes type 1 is what kind of disorder, and you're just staring there like, oh, I don't know what kind of disease, I just know what it is, I just know what it does to the body. Like, yeah, that's gonna hit you hard if you can't find the common ground, and knowing what they're like, learning the takeaway of what they're trying to tell you. Oh, I'm going. This is almost 30 minutes. I'm sorry if I'm rambling and repeating myself. But you get through this. Props to you. Yeah. But that's all I have about the resources. And that's my advice to people who are going through these resources and are nervous and anxious and kind of panicking. Right. And next time the importance of answering questions. So I'm just going to talk a little bit about like answering questions, and it's just so important just knowing how to take it, because I mentioned, if you have to understand why you got a question wrong, and because you might know the content. No one's doubting you. No one's saying you got the question wrong because you didn't know it. No one is there to tell you you're stupid. You're like, you didn't study hard enough. No one is there to tell you that. You studied the best you can. You're doing the best you can, and you do know the information. You know more than you think you know. So if you're beating yourself up when you get a question wrong because you're like, I didn't know it, like, don't do like, it's not you. Like, it's not that you didn't know it. It might have been because you read the question wrong. So it's very important when you're taking NCLEX and any testing, to be honest, like, take a deep breath, slow down. I know you have 5 hours to take this test, but 5 hours is definitely plenty of time to take an extra 10 to 20 seconds to reread a question, no matter how short it is or how long it is. Read what they're trying to ask you, so you can properly assess like what kind of priority they want you to do, right? And this goes into like priority questions that they tend to focus on, and they want you to understand like priority, and they want to remember, this is a safety test. This test is all about safety. They want to see how you assess a problem. They want to see how you assess a situation. They want to see what you do, and it's important to read the question, see what they're asking you, and understand, like, so they're giving you 4 patients. Who are you going to see first? They give you a patient. They're coding. They might ask you, what is the first thing you do? In CPR, the first thing you do is assess the environment, assess the area, check for safety. That is the first thing to do. What's the best thing to do in CPR? Chest compressions. It's a very simple, like, I'm giving you a very simple question, but they could throw you anything, any kind of situation, any kind of scenario at you, and you have to understand like things like first versus best, and things like stable versus unstable, ABCs, things like that. Those are your priority questions. And then delegation questions. So I'm not gonna say they go hand in hand, but understanding about delegation is also important. Like, what are you gonna give to someone who is unexperienced? Where are you gonna give to a UAP? Where are you gonna go give to an AP? Where are you gonna give an LVN? And remember about safety. Like, is it safe? Like, for example, is it safe to give a UAP a task of assessment? Will you let them assess? Like, no, right? You as the RN should be the one assessing the patient first. Like, try to remember about safety. Like, what would you do? Like, would you trust someone to do this, or do you trust them to be experienced enough to do something? That's what I would say. How to think about like delegation questions. Priority, it's all about your ABCs, your stable versus unstable, acute versus chronic, things like that. That's there's not much I can tell you about it except like to practice thinking what comes first, what comes best, or what to look for, and analyzing the information that they're giving you about your patient, because they could throw like a bunch of diseases at you, or a bunch of like surgery questions at you, and you're just going to be like, I have never learned that in my entire life. I have never seen that in my entire life. They don't care. All right. They don't, it's not about knowing that specific disease or that specific surgery. The takeaway should be they give you a surgery question. It doesn't matter what kind of surgery. You have to understand this is either a critical care question or a med surg question. So you understand that this is a med surg question, go back to think about the foundation you've learned about med surg. Like, what did they teach you about med surg? Go with the basics. Go with the skills that you learned in school. It's like, okay, in med surg, this is what they taught us about ABCs. They talked about stable versus unstable, chronic and acute. Who do you go to first? The acute patients. Who do you go to first? The patient who's having respiratory problems. Things like that. So understand like short versus long term as well. Like, if they've been here for a long time, they're typically considered chronic. Like, but are they higher priority? No. Do they have a condition? Do they have a condition that sounds like high priority? Is there something wrong with them at that moment? Is there a change in vital signs that says you have to go to them immediately? So that's the kind of thing you should think about when you're studying, and when you're studying for NCLEX. So anxiety, yeah. There's not much. I'm a very anxious person myself, and so what I would recommend is just sometimes it's okay to take a break. Don't beat yourself up if you think you need a break. If you think you need to step out, especially in the testing room. Like, you get 2 scheduled breaks. It doesn't eat into your time, but if you're not if it doesn't prompt you to take a break and you feel like you need to get up, that's okay. You just raise your hand, the proctor will come by, you ask, I need to take a break, or I need to go to the bathroom, whatever. They'll be like, okay, and they'll escort you out, and you take the time to just breathe, relax, take a breather. You take as long as you need, not too long, but enough that you feel like you're calm again, right? It's all about the breathing techniques are a real thing. Like, they help you. You need to have a quick prayer for yourself. Do that. Like, anything to help you relax, calm down, and reassert yourself that you got this. I can do this. I'm gonna go in there and do the best I can. So coming in with a positive mindset is important. And I still believe it makes a difference. I'm not gonna say it's gonna be like, this is gonna help. This is gonna be like, if I'm positive, I'll pass. I wish it was like that. It's not. But having a positive mindset helps. And I talked about like not knowing anything and remembering everything. And I'm going to stress this. It's okay if you don't know everything, and it's okay if you don't know something. Just take a breather. Like, if you start freaking out, like, put your hands up, like, not put your hands up, but like, put your hands back to yourself. Don't touch the keyboard. Don't touch the mouse. Read the question. Read it word for word. Analyze it. See what they're asking for, and understand the situation or the scenario they're giving. That kind of thing. All right, that's what you got to do, and answer it the best you can, and do the process of elimination. Remember the testing strategies that you learned from your study materials or what in nursing school. Use anything that you learn, implement them as you're testing, especially for questions that you don't understand or you don't know. And then move on. Once you answer it, move on. And that's the end of that. And again, you could get anything. Like you could get a couple math questions. Some people will be asking like, how many math questions did you get? Oh, I don't know my math. And like, no one gets a math question. Some people got 2 math questions, and some people are like, I got 10 math questions. Like, it is what it is. You get anything. You don't need to know everything, but you just be mindful that you could get anything. There's something wrong in trying to like focus your time, a little bit of your time in everything. It's just how you study. Just know what your weakness. It's all about strengths and weaknesses of yourself when you're studying. That's all it's about. And another thing is I wanted to touch on is like, so they changed it, so it's like 75 questions versus 145 questions now. That is the new like item list now. And the first time I took it, I'm also excluding like the research questions they do. And they ask you to take. You're not obligated to take them if you don't want to. So the first time I got cut off at 75. The second time I took all 145. There's nothing wrong in getting more questions. I've noticed a lot of people who say I got more than 75 questions. Is that bad? Like, it's not bad. Like, it's not a bad thing to get more than some 75 questions, because again, this is a computerized adapted testing test. So depending how you answered the first question will determine the difficulty of the second question. And if you got a question wrong, you typically the next question should give you like a 50-50 chance to like get it right. I've said this before, and I think that is how it works. If I am incorrect, please say in the comments, correct me, and I will mention this in the future and stress on that. But again, there's nothing wrong in getting as little as 75 questions or as long as 145 questions. It's not a bad thing. And I know a lot of people want to be like, oh, I passed in 75 questions, especially when there's a lot of people who announce like, oh yeah, I passed the NCLEX the first time in 75 questions. And you know, congratulations to them. Like, that's a great thing. That's so good. That's an achievement. That is an achievement. But for those who are getting like anxious about it, and when you're not, and when you get to the test and you realize you're not one of those people, or like you're not one of those people who just got 75 questions, is like you're gonna start to think that you're doing bad. And so I want to stress that you're not doing bad. Like, I would like to think like you're still in the game. Like, as Mark K said, like, you're still in the game and you're still being tested. They just they're still assessing you in a manner of speaking, I guess. And you could get cut off at any point. This could be, you could get cut off at 76. You could get cut off at 80. You could get off at 110. Like, I would go in there expecting to take the 145 questions. Just go in there and expect to take the whole thing, so you don't psych yourself out when you get past 75. Like, there's just nothing wrong with that. And that's sometimes when that gets to you, that affects your thinking. Like, you start panicking, and you're not digging in your brain for the knowledge that you were studying for. All your thing is like, I'm doing bad. I keep getting questions, or I'm doing worse, and you're not focused. Like, you're losing your focus, and that is what can make or break you and cause you to fail this test. And so that's not a good mindset to go in. And I would say, oh, if I only get, I would say to yourself, like, oh, if I get 75 questions, that's cool. Just think that's a neat thing. Don't be like, oh, I didn't get stopped at 75. I must have done terrible. Or, wow, that's so scary. Like, I think I passed because I did it 75 questions. You could pass or fail at any point. Like there's plenty of people who have gotten all 145 and they said they fail. Or there's people who say, I got through 75 questions, it cut me off, and I still fail. You never know. You really don't know whether or not you pass or fail. That's all I can say. So the best thing you can do is go in there, psych yourself up. You got this. Like, breathe, calm down, and just expect you're taking the whole 145 questions. If you get cut off at 75, you just get cut off at 75. If you get cut off at 110, you just get cut off at 110. If you get cut off at 145, like, if that you just took the whole 145, you just took the 145. And it is what it is. That's something you should tell yourself. It is what it is. You did everything you could. Move on and relax. Wait for your results. Or do the PVT trick, the Pearson VUE trick, and that's it. This video was way longer than I thought it would be. 40 minutes. If you got through all this, thank you for listening. I'm sorry for my rambling and repeating literally 10 times. So I'll go ahead and talk about the PVT trick as well. So with the Pearson VUE trick, the PVT trick is that when you're done with your exam, so usually in a couple hours, they'll send out an email saying, like, what are the next steps. I said this in the last video. Some people think that means they failed. No, it doesn't. Every single test taker get this email. It's just an obligatory. They're obligated to send this out to tell you what, to tell you what you should do next once you take it, like what to expect. They include what to expect if you end up failing, things like that. All right. So, but the moment you get that email is usually when you can do the trick. So once you get the email, you can wait like an hour or two and you're not sure since you just got it. But either way, at any point after you get the email, you'll get on the website, to schedule your test. Like, so you go through the process of scheduling under the NCLEX test, all right? Excuse me. And then what you do, and when you get to the point of like paying, don't put in your, you'll put in your debit/credit card number, but don't put in the whole don't put it in fully, so you can put in a fake number, basically. I'm sorry, I'm all over the place here. Yeah, so what you do, you put in a fake credit card number because it should still work the same way. Usually what I did, I just put in the full 16-digit code, but I put it in the wrong expiration date. It can be the wrong expiration date. You can try to put in a wrong number. You can put a wrong the security code. It doesn't matter. As long as one piece of information is wrong, this trick should still work either way. So what would happen is once you put in the information and you hit submit, you get two kinds of pop-ups. So we call them the good or bad pop-up. The good pop-up is it'll try to run through your cart, but it'll tell you they cannot reschedule it because you already scheduled it. That's a sign that you passed the test because they were trying to reschedule you for another one. A bad pop-up is that they try to run your card, but they say it's declined because you have the wrong information. You have the wrong. It's whatever they say you got wrong. you need to input it. That's the bad pop-up and indication that you failed the test. There has been false negatives though. I've heard that people got the bad pop-up, but they find out that they passed later after they paid for the quick results, or they checked their state board license account. So it's not like 100%, but as for the good pop-up, from what I know, that's like, I'd say like 98% accurate that you passed. But there's been like some cases where people got the false positives and they failed their test. But if this makes you feel better though, you know, you can go ahead and try it. And if you don't want to do the PBT trick, there's nothing wrong with that. Like, it's fine. It's not the end of the world if you don't do it. Especially if you're afraid of like them taking your money. That's also understandable, because most of the time, if you do put in your information correctly and they charge you $200, you probably won't get that money back if you passed. And I already passed that, so what the heck? But whatever. Yeah. Another way to check is, you know, continuously looking at your state board license test. They'll show you the licenses that are active and not whatnot. And they do tell you it takes up to 6 weeks, but mine updated in like 2 days, which is the same amount of time that I needed to check my quick results. The quick results are $8, so if you want to pay for that 2 days after your test, you can. If you don't want to, I would recommend just checking your state board account continuously for that active license. If you're not getting it, that's probably an indication that you failed. Or like one of your like licenses says delinquent status, because that's usually like your ATT kind of license until you pass your NCLEX. But this could be different in every state. This is just how it is for me in Texas. So there's that. But yeah. Well, I think that's wrapped up about everything I could talk about with me rambling and all that. Me annoying everyone for like almost 50 minutes. But I wish the best of luck for everyone. Again, if you have questions, please go ahead and comment below. If you want to talk to me like one-on-one, I'm willing to I'm willing to message you personally. I don't mind sending out my email and stuff like that, or just sending like a piece of social media. All right, have a good morning, afternoon, evening to everyone. Remember, you're doing the best you can. You got this. You got this. Bye.